Thank you, Mr. President. I do have a few comments to make, but before I do, I have a question, and I'm wondering if Senator Wickland would yield. Senator Wickland, I know there's been a great deal of discussion about the optometrists' scope of practice. Some of those changes I know have been coming for a long time. I do have one question regarding the language that has remained in the bill. Senator Wickland, I'm going to ask you about page 110, 110 lines 5 and 6. So I want to give you a minute to get that language in front of you. My question, Senator Wickland, is this. What in the language as adopted in your bill now would prohibit injections in the front of the eye? I realize that is the most concern as far as safety, since that is I believe surgery, and just concerned about that, and I'm wondering if you can tell me if you're intending that injections in front of the eye are now part of the scope of practice of optometrists, or perhaps there's something in lines 5 and 6 that limits that ability to inject directly into the eye by an optometrist.
Senator Wickland, to the question.
Thank you, Mr. President. Senator Nelson, I believe, I should say there's been a lot of discussion about those two lines, the clause 1, and in the bill this year that was introduced, what I believe prevents further injections than, I don't know if I can even say, the front of the eye, but retrobulbar, subtenon, and then obviously intravitreal injections are within the eyeball. So those are prohibited actions. What this bill does give, it does allow for the intramuscular injections and treatment for anaphylaxis.
Senator Nelson.
Thank you, Mr. President. So I understand that. My question, as one who has not been trained in medicine, I want to know if the intramuscularly, which is now allowed in your bill, is that an injection in the eyeball?
Senator Wickland, to the question.
Mr. President, I am not a physician, but I would say no, it is not. Intramuscularly means into a muscle, so
Senator Nelson.
Thank you, Mr. President. So what I heard was the intention of Senator Wickland is that this would not allow injections into the eyeball. That was the clarification that I was looking for. Now to my comments, Mr. President, to the bill in general. I know these are large bills. I've served on the Health and Human Services Committee for a good number of years, and I appreciate all of the hard work that has gone into this, the long hours and the great discussions. I have to say there are concerns that remain even after our discussion on the floor today. I'm concerned about the health coverage mandates that are in this bill. We know that makes health care more expensive. I'm not even sure if these mandates went through the Mandate Review Commission. I'm concerned greatly about the health insurance taxes. We know that making health care more expensive or making the health insurance coverage itself more expensive is moving in the wrong direction. I'm greatly concerned about the individual market stability and what is happening specifically in that regard. And then we must not forget what some of you call the provider tax, where I come from, and many people, we call it the sick tax. We actually tax people for being sick. We actually tax them for getting the medical care that they need. And we know that that funds the Healthcare Access Fund. And that fund has been raided over and over. Billions of dollars have been taken out of the Healthcare Access Fund, which is paid for by making healthcare more expensive. And yet here today, we are in a position where we're seeing the healthcare access fee, or the provider tax, or as I call it, the sick tax, is once again being increased. It just doesn't make sense that we would make healthcare more expensive at the time that some say they are trying to make it less costly. I'm also very concerned about the facility fee prohibition. Certainly we need more accountability and transparency in what those fees are, but to do a blanket submission is going to further increase healthcare costs. Those fees for all of those medical allied staff who help in the medical world, they're not the physicians, but let me tell you, there's a lot of important medically trained people that help with almost every patient encounter. And to say that that's not going to be covered in a facility fee, nor is the interoperability of the healthcare records. We know how important that is to be able to have your healthcare records at the palm of your hand. You can look and see exactly what the test showed, sometimes before you even get that call. This is so important. And then, of course, the facilities themselves, the maintenance of those facilities, and to think that those are not going to be charges anymore. What do you think is going to happen, folks? Well, the rest of those healthcare charges are just going to increase to cover those needs, or those important things in good health care will not be there. So I think it's very, very problematic, and it defies reason in my mind for us to think for 1 minute that the proposals in this bill are going to help healthcare. No, they're not. They're going to increase the cost of healthcare. They're going to make it so that it is less attainable and less affordable. I know that's not the desire of most people in this Senate chamber. I know it is not what my constituents are looking for. And so we are just raising fees across the board, and there's actual fee increases. There's 2 pages of them in here. I believe we have missed the mark, members, on this bill, and it's going to just continue to increase the cost of health care. I would encourage a no vote.